All right, here we go. So we're recording now. So we'll pick up, like I said, for just anybody late arriving. I should have the grades gone through mostly, and figure out some kind of a scale and grading procedure, and hopefully either later this afternoon. But I do have a bit to do, or perhaps tomorrow morning I will get that. So it brings us back, and this is we in the other group we had not done radiology, but I'm going to start for you. We won't go back to the physical methods of control with radiation, ionizing, and ultraviolet light, which was kind of where we were. And really, this is the point when we start to get into the chemical methods of control, which is a very significant subject with a lot of ramifications. This was just what's going on, just to clarify. So as I go back, just to go back and touch on it. So ionizing radiation is actually DNA strands to break. Very effective, used more commonly than you would think. Ultraviolet, while it has a usage, and we see this, the reason I'm underscoring ultraviolet is you're going to see this in genetics as well. Okay, so we get to the genetics chapter. But its lack of penetration, etc. But what it does very specifically is this: DNA segments, inevitably, it's A's, T's, G's, and C's. Periodically, you get thymines and sometimes even cytosines who are adjacent to one another. And what ultraviolet light does is it creates a bond. Okay, we call it a thymine dimer. So a dimer meaning there are two together. And what it does is, the best analogy for DNA is a zipper. And it opens and closes. That's all it is. Just like, so when it unravels and re-ravels, the dimer is like having a kink or a piece of something stuck in the zipper and it won't work. That's the best way to look at it. And if you have enough of those, it prevents replication, which is really what ultraviolet light does. It's not very good for destroying it, but it will prevent it from replicating. So, and that's why we use it a lot in food service again, because if you have made something and whatever's on top of there, as long as you can keep it from reproducing, it's not going to affect it as a consumable for a rather significant period of time in the presence of ultraviolet light. So it's very advantageous in that. Filtration, again, the filters, these are the ones certainly you use the most. They're used a lot. They're used extensively at home, whether it's in your furnace, whether it's in a vacuum cleaner, wherever it is, or in some hospital. So they are very advantageous. The osmotic aspects are very significant when you get to it. It's really what you're doing is you're pulling out, okay, moisture out of the system. And you remember, pulling moisture out of the system is devastating for microorganisms. So they salt or sugar. The name we give it is curing. You can put other flavors in there as well. Very hypertonic, leads to plasmolysis. And these are other, and they've been around forever. And so with acidity is what pickling is. Smoking is sort of low, constant presentation of heat. And it is effective depending on what you have. Typically, when something is smoked, it's smoked and cured. In other words, if you're fond of smoked salmon, it was very, very popular. Okay, or particularly in cooler climates, because there's a lot of salmon fishing that goes on. They will cure it with salt and dill and sugars, and then once that's done, then they will smoke it. And depending on the temperature, it'll take a certain amount of time. And a lot of people consume that. Smoked fish is very popular, depending on the culture that it is. Not everybody, but some. And osmotic pressure, typically not sterilizing at all. And that's really what you need to know about that. Which brings us to this, which are methods of control from a chemical perspective. We refer to them generically as germicides. So it's very non-specific. Germ, what is it? A virus, bacteria, prion, protozoan? We don't know. Okay, so it's a very non-specific term. And so it's a generic term that is not really a great one to use, but sort of globally is used. And they are also, so being a chemical agent of some type, it can be any one of these states, and we'll have examples of all. They are most commonly liquids by far. We do see things in solid state, which you will see, and gaseous, you might have heard me mention before about using poison gas to sterilize, is used extensively, particularly in healthcare. And again, the classifications are typically either disinfectants or antiseptics, and if they have the capability under certain circumstances, they become steriles. So most of what we look at that we work with are called solutions. These are solution just means it's something dissolved in water, and at least 50% of what you're dissolving in is water. That's the definition of a solution. And everything dissolves in it. You can see through it. They're by definition clear. Okay, where a tincture, okay, have to be at least 50% alcohol. I'll historically comment on tinctures because they were used a lot. When we get to iodine, when we get to mercuric compounds, their original application was in something called tinctures. So they were mixtures of predominantly alcohol with water, but not the majority being water. It's a fine point. Okay. I don't know how, if that's something that those of you who end up taking pharmacology will or will not have to know. Just so it's a good idea to know about it now. So, first thing you state on this particular slide, nothing is a panacea. Ain't nothing perfect. It's the oldest truism in science and in medicine. If there's one best way to do it, we'd all do it. If there's one best surgery to do for a broken leg, we'd all do the same surgery. There aren't a whole lot of those. When it comes to what we want, a germicide, there's nothing perfect. Sometimes they're too strong to be used on things. They leave residues. They smell bad. They're difficult for people with respiratory problems. They're hard to maintain. They don't last very long. A litany. So we do the best we can for the circumstances. And why this is so relevant, particularly for healthcare, particularly for future nurses, is to understand that a lot of times you have to make that decision on what works best in the facility you're doing it in and instruct others in how to use it. So we like something that works fast, even if it's got low concentrations. Great. We like it to be stable when we dissolve it, and that's not always the case. Bleach is a paramount example. We don't use pure bleach, we dilute it. But once we start to dilute it, in 24 hours, it loses a substantial amount of its potency. So that, and I know you use it in the lab because the lab is a little bit different. We want something that's going to be more of a local disinfectant. But those bottles that have bleach, and if you're squirting down those tables in lab, if they don't change that out every day, every 24 hours, it's not nearly as effective. For our purposes, it's fine because we're not dealing in an area where we require maximum effort for that. We want something that's clean from students to students, and it's not going to have a whole bunch of stuff on them, on their hands to be irritated or things like that. But that's the truth. We like it to be non-toxic to human and animal tissues. Hard to find. Okay. We like it to be able to penetrate inanimate surfaces and persist. Yeah, as long as it's there, if it's strong, it's going to irritate. Very, very few are not inactivated by organic matter. That's a big problem. That was that nugget about sterilization. You got to clean off the instruments. Because once it dries and cakes and hardens, the heat can't get through. The same, to some extent, is true for the chemicals. That's why Lister used phenolic compounds, and why phenols were used a lot. They work well in the presence of organic matter. A lot of them are corrosive. A lot of them stain. You'll find, for those of you, and many of you will be doing it in particular uniforms, even scrubs of your own. Okay, it's a pain to get stuff cleaned out. And you'll learn all sorts of ways of doing that are there. Yeah, nice if it doesn't smell bad. It would be nice if it's affordable. Yeah, all great. I don't really delve too much in this. To me, they're either high level and we would want to use them, whether they are sterilant by killing endospores or not. Okay. And everything else is sort of not that significant. We use them. So if we're looking to sterilize or looking to really get a high level of cleaning on a surface, like a strong disinfectant agent, they would be in this area. The rest of these are just things that we use depending on circumstances. So I'm not going to ask you about that. Know if something is a sterilant, that's important. We'll get to that. Nature, what kind of organisms are we treating? What's the material? how contaminated, how much time do we have? All of those are factors you figure in somewhat, again, somewhat generically. There's no formula for that. The best assumption to make is it's a mess. Okay, it's contaminated. We want to, in some way, shape, or form, render it useful for whatever procedure or purpose we're going to use for it. That's the best way. So, the interesting charts, okay, things like that. And so you can look at the concentration of the time. We can address difficult things like tuberculosis with it's not an enormous concentration or enormous amount of time, as opposed to an hour and a half for entomoebic cysts. Those are water contaminants that are there. Hepatitis A, as you can see, very comparatively rapidly. Okay, hepatitis A is a naked virus, as you'll find, not enveloped. Here's alcohol. Okay, when we use an alcohol, it's unlikely that we would ever have something that would be there for 10 minutes, like a virus or Staph aureus. Okay, E. coli, relatively simple. Alcohol, I mean, we don't immerse it in, which is standard isopropyl rubbing alcohol. We don't let it sit in there and soak in alcohol. Alcohol tends to, once it comes out, alcohol evaporates very, very rapidly. That's the good news, bad news, as you will see. Hydrogen peroxide. Interesting, because we use it a lot. As you can see, you don't need a lot of exposure comparatively to it, particularly in certain phases. You're going to see learn a lot about these called quats, quaternary ammonium compounds or salts. They are the mainstay of food service antiseptics, and every time you use an antibacterial soap now, that's what's in there. That's the stuff. Ethylene oxide is the poison gas, and you can see you need a long exposure time for that. And then we'll get into all of these, whether it's halogens, which is chlorine and iodine. We have other uses for fluoride and bromine that are there. So we'll look at both of those without going through all the laundry list. The oxidizing agents, we'll look at aldehydes, which are very, very powerful. There's a lot to be said. The gaseous agents, the phenolic agents, these are the categories. Okay, and for the longest time, maybe, as you can see here, phenolics makes them dangerous. Remember I said they were great for organic substances with Lister used initially, but banned in consumer products in 2017, particularly this guy called triclosan. That was the common ingredient in antibacterial soap. They all contain triclosan. Then they began to study it as it was used extensively for about 20 years. And as they studied it, they began to see organ samples that were contaminated with it. Liver samples, other organs of things that were biopsied, they were testing. Typically in cadavers or people who were recently deceased, in an effort to study what was going on. And there were some real alarming things about that. That's always been a little bit of a problem with phenolic compounds. Okay, so we use them less than we used to. Doesn't mean we don't use them, but we use them considerably less than we used to. Chlorhexidine, I'll talk about. It's a very interesting category that sort of has an interesting, almost a unique structural characteristic compared to phenols. We'll talk about alcohol, detergents. And I know I'm going through as fast as I have another chart to show. All that, heavy metals, these are all categories. You need to know them by their categories, and I will get to that. So without going through all that stuff right now, I'm going to escape from that. And this is where, again, I have a greater degree of comfort with the Nestor PowerPoint because of the way they have presented the information with regard to the charting that they do when we get to that area.
So what PowerPoint are you on now?
This is whatever it says up there. Forgive me. Chapter 5, Lecture PowerPoint A, PPTX. And that's Nestor's PowerPoint 5. They're all in the same. They're located next to each other, of course. So let me get there for you.
What week would that be under?
Yeah, week 2. All week 2. Oh, I'm back on the wrong one. I'm sorry. I should have set that up. Here we go. So germicidal chemicals. If it's an antiseptic, this is also important stuff. Remember, antiseptics are used on human tissue. They're under the control of the Food and Drug Administration. That's who tests them. Disinfectants are not designed to be used on living tissue. They are on inanimate objects. That's Environmental Protection Agency. So you always have to be familiar a little bit with what the category is. That's the kind of thing that when they do safety inspections, places where you have to store certain things, particularly in a hospital environment, things you have to be aware of. You all know what a sharps container is, right? You all know there's a way that you have to remove a needle and all that. And if not, they're going to teach you forever about it. Proper way to take off a needle, where to put it. Sharps containers are for sharps. Now, if you walk around in a hospital, in a doctor's office, there'll be gauze pads in there. Someone will throw a glove in there. That's not a sharp. You're putting something in the wrong place. See, what surveyors do, when they come in, they open that up. And gloves, masks, they're all gowned up. And they're taking out on sterile thing, and they're going to put stuff that should be in there and stuff that isn't. And they fine the institution for every time there's something in there that isn't. Understand? And then the blowback is on you. You're the charge nurse here. What's going on? This is your department. So people have to be. Oh, good. Yay. It's okay. Change of command. My son, when he's,
Okay.
we had May 23rd.
Where are they sending it?
He's going back this year.
Oh, okay, good.
Yeah, he's back. Very expensive.
Yeah.
Holy moly. Never, I was concerned, but because I thought it was going to be in the middle of school, it's going to be in May after we're done with the term. Okay, so you got that nugget that's there. That's why this is important. I'm not telling you, this isn't for my edification. Oh, it's more stuff he wants us to memorize in another one of these ridiculous tests. I've seen this movie. I've been doing this for 25 years with prospective nursing students. It's a long time. Okay. There's all these little things you have to be prepared for when you get there. So you have to understand that, and you're the ones, many of you, whether it's nursing or whether you're in another healthcare related field, you get to a certain point where you have to tell them they don't know what to do. You got to tell them what to do. And you can't, it's not like, oh, please do it. It's your job. You get to the point where, and there's a right way to give orders and respond to criticism or questions. All of those things. So there's a certain amount of that's going on. So I do want you to be familiar. You might take a little extra time. Okay. This is the same thing you saw a slide before. Okay. That's, it's a standard, like a bleach bottle, whatever it is. I don't even know what it is. Something that's like their EPA, safer product standards, whatever it is, sensitive skin, blah, 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 blah. All that type of stuff. So you can look through that. I don't have to read it again. So that's all the things. So we're going to start with the different classes. At the end, and I'll come back. At the end, you'll see that. A couple of pages of tables. That's a critical table for you to be familiar with. Let us begin. Number one in the hit parade, alcohols. Authors have said that alcohols are both disinfectants and antiseptics. I disagree. They are antiseptics because they really are not particularly effective disinfectants unless you want to take a basin of alcohol and stick something in there for 10 minutes and you don't really have the opportunity. It's not particularly useful, and there's a lot of limitations. So ethyl or isopropyl alcohol, typically 70%. Every so often you'll see absolute alcohol for certain purposes at like 90 or 95%. But for our purposes, we're looking at that's the active ingredient that's over there in hand sanitizer. The only difference between liquid alcohol and hand sanitizer is in a gel. And the gel just makes it easy. And the best thing about alcohol is the worst thing about alcohol. It evaporates quickly. The best thing about hand sanitizers, they've been great, is that for routine exposures, all you have to do is in between patients, in between procedures, do that. You know, you put it on, 30 seconds, see you later. There's a certain amount of mechanical action that helps to assist that, and everything's great. If you want to wash your hands and use hand sanitizer afterwards, go ahead. That's what you do when you're exposed to C. diff, because it's insufficient alone for C. diff if you did not know that. So if you have a patient with C. diff, there's an increased likelihood that those endospores, which wouldn't be sensitive to alcohol at all, will do much better with soap and water and the mechanical action that's there. Then if you feel like using the alcohol afterwards, go ahead. It dries quickly. You're not dripping stuff on the floor. You're not dripping stuff on people. That's the good news. The bad news is it evaporates quickly. You wipe it on somebody's skin, quote unquote, to cleanse the skin, and it really, the only thing it is targeting is enveloped viruses and easy to kill bacteria. Naked viruses, the mechanical activity is the best thing. You use soap and water just as effectively, I think. But whatever the procedure is that calls for in the facility that you are going to be in, that is what you do. You may get to a stage where you might be in a position to make some arguments to change certain things, but certainly not initially. Okay, and young people do that aside. You have to get to a certain stage where you can sort of make a suggestion, and people will listen to you, as opposed to, the first day you're there, I don't like the way you do this. Well, let me tell you, they'll find somebody else. The reality of life. Okay, not reliable against naked viruses or endospores. It mostly damages membranes, a little bit of denaturing. Okay, as you can see, alcohol is less effective in certain instances that are there. Yeah, it's commonly used as a disinfectant, and yes, it's non-toxic. It's inexpensive. The vapors are not a problem. They scent them all the time that are there. Evaporates quickly, and there's some materials that can't deal with it. Okay, so it's good news and bad news. But what it has done here is people are much more willing to use hand sanitizers. There's no stigma attached to it. Nobody will ever say anything to somebody who's on the way in or out the door here, put some hand sanitizer on. Wash your hands. You kind of go, oh, well, that's cool. That's what you want to do, that's fine. We've become, non-judgmental about that. You must see somebody who's hand sanitizing every time they touch anything. Because I go nuts at the supermarket anyway. Oh my God, I'm going to die if I touch this cart and somebody else was here. Sidebar note, the CDC is now changing the COVID. It's an article that occurred in the last 24 to 48 hours. They're going to take away that 5-day, until you test period. What they're going to do in the university, I don't know. That's a subset. That's a rule made locally. But basically they're saying it's here to stay. We're not going to treat it any different than if somebody has the flu or some other type of viral infection. That's basically what it's saying. It's mutated to the point where we realize we're not going to be able to see it disappear. Okay, and it's become much more like, we're going to periodically get some nasty strains, and they may flip that around a little. And anybody who's studied this long enough would have been an easy prediction. Aldehydes, most commonly used agent for what's called cold liquid sterilization. Used all the time. I used glutaraldehyde in my office for 25 years. The beauty of it is 2%, and the interesting thing is it comes super concentrated. So you get a container, you dilute it in the appropriate amount of like distilled water, and you can soak instruments overnight, typically 6 to 10, maybe 12 hours, and it's very, very effective. Then we would lift them out of what we call a boat or a barred Parker tray, perforations on the bottom, let the liquid drain off. There's a nasty residue. You put on gloves, you wipe that off with some sterile material, you cleanse it off with a little bit of alcohol just to make sure you get rid of the residue. Lay them out in between patients. We did that. That was a fixed thing that my staff did every day. change out the solutions in the 3 or 4 treatment rooms. And I'm no different than anybody else. Again, most of these are inactivating or denaturing proteins. Okay, time is the limitation. You can put it back in there in between. It will disinfect them, but it will not sterilize them. So if you require a sterile instrument, that's different. So you have to rinse it after use, and you have to probably remove the residue before use. They have tried to play with it. Some of these will discolor the skin. Years ago, this is the first other sub nugget we're talking about that's really important, is formaldehyde. Formaldehyde is the stuff in the operating room that you will put, let's say you remove a piece of bone or a piece of skin with a mole in it that you want to have examined to make sure it's not cancerous. We put it into that, it instantly preserves it in such a way that it makes it easy down the road for the lab, pathology department of the lab, to take sections of it and be able to analyze whether it is cancerous or not, or a problem or not. Anytime you're removing something, that's the documentation is called a biopsy. So all those things are sent to the laboratory and operated. You did not know it, that's the way they work. Okay. So it could be used as a gas. And years ago, we used to use 37% when it was dissolved in water, and it had some clinical applications. People who perspired a lot, they used to use it. It was very irritating to the skin. Okay, it's super effective. Yeah, okay, they can be sterilants. Inactivate virus vaccine is but understand it's probably a carcinogen and the preservation. This is the big nugget. Part of today's discussion involves the theory behind, pardon me for not getting up, I kind of hurt a muscle the other day, involves vaccine laxity. One of the big problems with vaccines, and it's a very fair argument, is the stuff they put in it to preserve. That's always been the issue. The first of these, and it was used historically, was formaldehyde. Formaldehyde is carcinogen. It's not even, it's likely. It stings. It's unpleasant. It's nasty. Stuff in the lab used to come in formaldehyde. We have to, if you find any old specimens, you have to use them under the hood. The vapors are nasty. That was what they used to preserve vaccines. I don't know about you. I'm uncomfortable, okay, with injecting something into somebody, particularly a baby or an infant, that's got a bunch of bad stuff in it. That's just me. And a lot of people are. That's part of the argument. I understand that the purpose of this discussion is not to say to people, well, you shouldn't get kids vaccinated, because unfortunately, we still have a lot of things around here. As many as we have, I think, is a significant issue. How we're doing them and how frequently, I think that's a significant issue. I think we have to re-examine it going forward. Not my area of expertise. More on that later. So that's the first one that's in this, aldehydes. Yeah, and they're still useful as cold liquids, so they are a sterilant by definition. I went from alcohol, limited applications, but useful. Aldehydes, certainly applications, but concerns. Biguanides, absolutely the prime category that you're going to get used to in a hospital environment. You'll see the names chlorhexidine, like you can see here, Hibiclens, Hexaclens. If you have, as many students do at this time of their lives, get your wisdom teeth out, you're going to be getting a mouthwash that's got 2% chlorhexidine in it, or maybe even less, maybe 0.02, whatever the thing is. It's very, very common agent after dental procedures, and particularly after like wisdom teeth removals. Right? A great antiseptic. It does not irritate tissue. It stays on the skin. It has for something along this line, just good. We can put it on catheters. It comes and this and iodines, when they're mixed with soap, actually get better. They're actually easier to use, and they are more powerful. So the combination is wonderful. And so there are two agents when you go in a scrub area in a hospital for surgery, as many of you will see and be exposed to, and you're going to see brushes that have like a sponge on one side and a brush for your nails on the other side there, and the brush and the sponge part's impregnated. It's already got a certain soap in it. One will be a betadine soap, the other will be a chlorhexidine soap. Betadine is sort of a brownish yellow color. The chlorhexidine comes like a white pink color. A lot of studies have shown they're roughly equal. Chlorhexidine actually tests a little better. When I would scrub, when it was available, and it wasn't available extensively, I used the chlorhexidine soaps. I haven't been in an operating room in 23 years, but my kids have been in emergency rooms over the years. And I went, and I'm curious. So I would always look and see what the soap was in between the rooms. At like St. Margaret's or any of the other. St. Margaret's when I went to the most over in Aspen. And finally, in about, I don't know, within the last 15 to 20 years since I've been teaching this, they changed to chlorhexidine. So that tells you everything. We didn't use it a lot because it was expensive then. But when UPMC is the 800-pound gorilla. When it changes something, everybody. We have the lockdown here. Students were asking me before, are we going to lock down? I said, as soon as Pitt says it's going to lock down, we'll lock down that day. Absolutely. So UPMC is an enormous healthcare provider all over. When it decided to go to chlorhexidine, everybody else, okay, they're doing it, we got to do it. So it is very, very useful, relatively safe, can save it on indwelling catheters. There's a lot of importance with that. So you understand why I'm giving you a long spiel about it. Where that is an antiseptic, this is purely a sterilant and you could use it theoretically on inanimate objects, and we do, but it sterilizes them. And it's called ethylene oxide, and it's poison gas. When I started in practice more than 40 years ago, you could buy a chamber and get a cartridge with this gas. All we knew is it's sterilized. We didn't know how harmful. It's called a gas clave. And you could do your instruments in there rather than an autoclave with steam. That went away shortly thereafter because they found out a lot of things about it, that it was explosive, toxic, and potentially carcinogenic. Not going to let people use it. But again, every needle, every syringe, every drape, every gown, every glove, tons of paper products, those Q-tips you're using in the lab, Band-Aids. They have a room this size, shelves filled with a paper that's sealed and permeable to the gas, because gas molecules are tiny. And they put it in there and expose it for X number of hours, typically 12 to 24. Then they have a system where they suck out and are able to contain or somehow change the gas, so it's no longer environmentally problematic. So it penetrates artificial joints. All are sterilized with this. When they go to the hospital, they're in a sterile packet. Okay. It's almost like sealed. It's like one of those sealed packets. So they've already sucked out as much of the gas as possible that's in there. And then we have sizers that are autoclavable, made out of like a special rubber material that you'll put into the joint, let's say an elbow or a shoulder, and say, okay, I need size number 43. And the representative for the company, the sales rep, will have a case of them with them in the operating room and say, here you go. And then they'll put that in. That's how it works. It's very much of a changing world in those types of things. So all of these things are like that. The Petri dishes in the lab, when you open up, they were sterilized. Okay. We open them up, the outside becomes non-sterile, but the inside is still sterile. You'll have sealed pipettes. So all of that must be eliminated by heated forced air for a considerable amount of time. So now, again, the EPA has a number of restrictions, and I'm sure they're the same, anywhere where these are utilized. Important. Biggest single categories here at the time. Halogens. Periodic table, you remember this from AP1? It's a science classroom. We have Here we have an imaginary periodic table in downstairs in 141. I had them put it up. We have a real periodic table. That's how you know anything is a science classroom. We all had the same chemistry guy in high school. Flat top haircut, white shirt, bow tie. Same biology teacher. Man or lady had jars filled with weird things that, you had that. 6 legs, 4 legs, 23 legs. You all had that same person. They haven't changed. The names have changed. Before she was steamed. Oh my God. So you can see I've even made, there's helium over there. But next to that, the inert agents, you have fluorine, chlorine, iodine, bromine. Remember, those are the halogens. Okay. Halogens are wonderful agents. They're highly toxic, particularly to a lot of things, and microorganisms are one of them. We tend to stay away from halogens and things in our environment. Halogenated compounds are something. Years ago, they had one called carbon tetrachloride. It was the original cleaning fluid that my mom had her. It was this CCl, Cl, the forming. That stuff, poisons, terrible odors. But when my mom had a stain on something, something spilled on the carpet or on the furniture, get that stuff. Oh my God, can't breathe. So those are halogens. So that's chlorine. Surely the most commonly used all over. So destroy. So they're a sterilant. It's typically used as a disinfectant and can sterilize. But again, liquid sterilization is a function of time. So as little as 3 to as much as 12 hours. So you're spraying down the tables with chlorine in the lab. It will disinfect them. It will not sterilize. The problem, and it's very caustic. And so all you need to do at home, you get one of those little spritzy bottles anywhere, go to Walmart, okay, put about, I don't know, an ounce or two of Clorox in about, as you can see the dilution, 1 to 100. So you could put an ounce or two in a gallon of water, shake it up a little bit, and you're good to go. Trouble is, again, 24 hours, every 24 hours it becomes less potent. So we can use tiny levels for drinking water. So that has been used. I think they use other methods now because a lot of times you'll get a funny taste in the water, metallic. So if they're using it, that, what helps that, those filters, Britas and pure filters, that type of stuff really helps that. So yeah, because we use those at home. Okay. It has some work with organic compounds. It's the overall toxicity and the smell that is there. Okay. And you can see they can use other forms in gaseous forms that can be sterilized. And you'll notice here, these are things, and you have them at home, you have them for cooking. Certain things we put into certain types of containers because sunlight impacts them. So you'll never buy extra virgin olive oil in a clear container. It'll always be relatively opaque, and you always keep it out of sunlight. So sunlight affects these. That's why they look that way. And so usually it's about 6%. If you get it for the pool, they'll have ones that are up to 10%. If you're using it as something for a pool to react. So that's really a disinfectant, where iodines are really an antiseptic. Okay, they are vegetative cells. They don't do anything with endospores, but they're useful. Originally, it was tincture of iodine. Had a little skull and crossbones because it was toxic on the little vial. And the mom chased you around and scraped your knee. Put that on, it stung like anything. Because iodine sting and the alcohol stung. So, and we didn't use it extensively until magically years ago, and I was already in the game. So I don't even know, 50, 60, 70 years ago, we got betadine. Betadine is a combination of two things. Povidone, which is a protein carrier. Plus regular iodine. magically put them together and you get betadine. It goes by a whole lot of different names that are there. What it does is it more slowly releases the iodine. And what that does is it is less irritating. And even better, like I was telling you about with the biguanides,
Happy Valentine's Day.
thank you.
Of course.
I'll give this to my wife.
Hey, well, this means our test is online Friday, right?
Cool.
It was worth a shot.
TCFW. Too cute for words. There are students who like me.
We're right here.
Yeah,
Yeah.
exactly.
Not everybody after the test, I can tell. See a lot of unhappy faces. Grace wouldn't even come. She was so upset. You know, she was sick. I know. I didn't know. So that's why it's wonderful. Its power is released by soap. It's much less irritating. It is, a couple little nuggets. People used to use straight iodine dressings on wounds. Iodine is still cytotoxic. They used to call them, it was called betadine wet to dries. You put a gauze pad with iodine on it, you put it on an open wound that was starting to heal, and then you peel it off. Medieval. You know, when you pull a Band-Aid over something, it hurts so much. What you're doing is you're damaging the new cells that are forming. So we stopped doing that. The same thing, you'll hear it. And again, you're in nursing and they say we're going to use saline wet to dries or betadine wet to dries. Do not say, Dr. Stein said that's medieval and torture and you're killing cells. So, okay. But the reality is, well, wound healing has changed dramatically. We use moist areas. We use everything from polysporin or neosporin, depending on allergies, because they are not tissue toxic. Betadine ointment, which they don't use so much anymore, was in that category. And so what happens is when it dries and it adheres, and they used it to degrade or remove stuff. It shouldn't be there, and the trouble was it was damaging the new cells that were forming. So the way to use betadine is to dilute it about 1 to 10. They did the studies up at Harvard and Mass General Hospital. One of my wasn't a colleague, he was a student under me, was doing the reporting about that. There was a lot of research done about that. And they do the same thing with peroxide. Full strength betadine out of the bottle, full strength peroxide these are of the solutions out of the bottle. You don't want to use directly on wounds. Just a side note. The trouble with it, you may see it in the lab. Have you used the grams of iodide in the lab? You've used the other stains. You know that crusty stuff around the little bottles? That's bad. And they all do that. They crystallize. And what happens in those crystals in iodine, Pseudomonas, which is a horrible, although very common hospital-based infection, it grows in there. So, I mean, there's a lot of issues with that. That's why when you see that crusty stuff, you're working in a hospital environment, that's the time to throw that bottle away. Or at least pour the liquid stuff into something else. And that's important. We have enough time to do the metals. Okay. Same kind of discussion here. The metals, well, typically what metals do, these are called sulfur. A lot of proteins have sulfur groups on them, on the certain amino acids. Okay. Cysteine and homocysteine have stuff. But what happens is they interact with that particular area and it clobbers it. Kills the protein. So they're very, very toxic. Ones that have worked. Traditionally, we used gold and silver in filaments. It was very expensive, but that metal retarded infection. And so if you have folks my age would have gold or silver filaments. And the difficulty with gold and silver was the amount of toxicity it had in the system, and they were expensive. So then they began to use different metal alloys that had the same effect but were less expensive. They called them non-precious metal alloys. And then then we got to the cosmetic aspect where you could put things in it. Okay. So people were much more aware of the higher level of mental cosmesis. So, we start with that. Okay, so silver. Remember I told you there's one best thing, everybody uses it? Here it is. Silvadene cream. It's a silver-based cream which has got silver and a sulfa drug in it, and it is absolutely the best topical agent in the world for burns. We've been using it forever, and they will continue using it. I said everybody uses it because it's the agent of choice. So that's its biggest usage today, silver in that. Now, years ago, they used to use silver nitrate in babies' eyes. Now we use antibiotic drops. Why we stopped using it is not because it was for gonorrhea. It wasn't because it was ineffective for gonorrhea. It's because silver nitrate stains the skin black. It does. If you work in a chemistry lab and you're not wearing gloves and you get some of that on your hands, no black skin, you'll go away. But moms would see their babies come out with black eyes and go, oh my God. That's exactly what happened. So they stopped using it, but it's mandatory to use antibiotic drops in newborns because now we're concerned about gonorrhea and chlamydia and a few other things. And then all the other these were widely used as preservatives and topically, and they're very strictly regulated. The biggest one, when I was a kid, the iodine was an awful tincture. The one that was before it was red. It had mercury and it was called tincture. You may have heard this name of merthiolate. So it's a mercuric compound. Mercury is Hg. Okay. Mercury is a neurotoxin. Okay. And here we get to the faulty research that caused the start of vaccine laxity. People questioning vaccines to this day. This is an agent, I'm not sure the spelling, called thimerosal. It's used extensively in vaccines. It is a mercury compound. If you and I, as adults, got it, we'd get more mercury if we went to Lent, right? Okay. We have more mercury if we went to the fish fry. Church on Friday. Jewish guy goes, so much fried fish, so goes on. Okay. But for a baby, neurotoxin. So they did a study in England, and it was faulty. It couldn't be duplicated. It was poorly done. The results were kind of fishy. You know what I mean? It was called out as being faulty research. Basically, the author suggested strongly that thimerosal-based vaccines caused this dramatic increase we've seen in autism. It didn't prove it's true or not true, but it scared the heck out of a lot of people, even though they debunked it. Even they said that they showed that this is true. The reality is if you go to a doctor and he says, well, they've never shown that thimerosal, here's my baby, does that vaccine have thimerosal? Well, they've never shown that thimerosal causes autism. And the counter to that is very simple. Did they ever have a study that showed it is not? The fact that you showed something does not doesn't mean that it does not. Okay, it doesn't cause or it does cause. There's no definitive study that shows one way or the other. There's nothing that says it does cause autism and nothing says it does not cause autism, which means, and you should ask for this if you go to your pediatrician, I'd like thimerosal-free vaccines, period, end of sentence. If they say they're too expensive, they're not. They say they're unavailable, they're wrong, they are. And there's a lot of doctors right now, there's a lot of them. Go to the one who you like, who is willing to work with you. That's my silent note. And so that's where we'll come back to ozone next time. I should have the exam stuff up. Thank you. Oh, I'm happy I got it.